Jennifer, and I'm going to be your nurse for today. Is it okay if I close the door for privacy? Okay. All right, and as I was saying, I'm Jennifer Temby. I'm one of the RNs here, and I'm going to be your nurse today. Do you mind if I just put this down? All right, I'm just going to clean my hands. And can you state your name and date of birth for me? Okay, and I'm just going to check that against your ID band. Okay, Millie Larson, January 1st, 1936. Perfect, that matches what I have too. And any allergies to medication? No, okay, perfect. Professor, normally I would never put anything down the patient's bed, but for the purpose of the video, I'm just gonna put my clipboard with the MAR here. I'm also gonna move this arm out the way. The ID band is on it. We are going to use the upper outer aspect of the arm, so this area here for the subcutaneous tissue. And I want to go over the 6 rights of medication administration. So the right patient, the right medication, the right dose, the right route, the right time, and the right documentation. Let's go over supplies. So I have my hand sanitizer, my Sharps Biohazard container, medium-sized gloves, paper tape. Down here I have a trash bin, alcohol pads, gauze sponge, Practa Insulin Lispro, and it is 10 mLs and there is 100 units per ml. And the expiration date is October 2027, so it's still within time frame. I did my first med check when I pulled the medication before coming into the patient's room. I checked it against the doctor's orders, so that was my first check already done. And lastly, I have a Safety Glide insulin syringe. It is 1 ml, and 29 is the gauge and a ½ inch. So this will be perfect for our sub-Q injection. Okay, so with that being said, I want to get started. I'm just going to move this a little bit. I'm going to use a lemon for the purpose of this video as to be my upper outer aspect of the arm on the patient. Okay. So what I'm going to do now is do my second check. So I have Practa Insulin Lispro, which is what I have here, and the doctor ordered 10 units with breakfast. The patient was in the middle of eating, but I asked them if it was okay to stop to give them their medication. So I am going to check that, and again, the expiration date is October 2027. What I also want to do is label some paper tapes, like I'll label my syringe after. Okay, so I have, don't know if you can see that clearly, but it's Practa Insulin in 10 units. So when I draw it up, I can have that ready to go. Okay, so I completed my second check, the medication against the doctor's order. I'm going to take the top of the vial off. I'm going to clean it with alcohol. Just want to show you. Okay. And 10 units. These syringes are for insulin, so the increments are units. And I'm going to draw back to 10 units. Okay. And I just want to make sure there's no air bubbles. Okay, we are at 10 units. I am going to recap, but I'm going to do this one-handed so it's done safely. Okay. Okay, Mrs. Larson, I'm going to clean your upper arm with some alcohol. So we're going to start inward, Professor, working our way outward with the alcohol. And we're going to let that dry. I am also going to label my syringe. You can see there is a label on there, okay? I'm going to now perform my third and final check. So against the doctor's orders, we have Practa-Insulin Lispro, 10 units subcutaneous with breakfast. And with my vial and my labeled syringe, I have Practa-Insulin and Practa-Insulin Lispro, and I have 10 units. So it's exactly what the doctor ordered. Okay. So the alcohol is now dried on the patient. I'm going to take off my safety cap. And with my thumb and index finger, I'm going to pinch the skin ever so slightly so it raises. And with a 45 to 90 degree angle, I'm going to inject the patient. All right, injecting now. I want to go straight in. I'm going to slowly inject the medication. And I'm going to pull straight out and let go. I'm going to engage my safety now. So my needle safety has been engaged, and I'm going to dispose of this in the biohazard container. I'm going to use a little bit of gauze on the patient. I see there's a little drop of blood. I'm just going to dab, no rubbing. Okay. Going to dispose of my gloves and sanitize my hands one more time. Okay. Mrs. Larson, how are you feeling? Didn't feel a thing. That's what I love to hear. Okay, I'm just going to document that we gave you your medication. So again, Professor, Practa-Insulin Lispro 10 units subcutaneous with breakfast. And we did give it. So I'm going to initial. Okay. Mrs. Larson, is there anything else I could do for you before I leave? You're going to enjoy the rest of your breakfast? Okay, great. And if you need anything, you have your call bell right here. Are you comfortable in your position and you're okay with where your food tray is? Okay, perfect. All right, I will see you a little later. Enjoy breakfast.